Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy. Welcome, everyone. It is so great to be here with you all. I have another wonderful guest with me today. Joining me is Michelle Spencer, a Functional Nurse Academy graduate who is also a postpartum nurse. She is a whistleblower and the founder of Healing Ground, a holistic health practice dedicated to supporting individuals with chronic conditions, including vaccine injuries. After witnessing systemic corruption and safety concerns within the conventional medical model, Michelle courageously spoke out about the risks associated with the hepatitis B vaccine and the rise in fetal and maternal complications post-COVID vaccination. She now specializes in alternative healing modalities such as NAET and acupuncture, providing evidence-based patient-centered care outside of the mainstream system. Through Healing Ground, Michelle empowers individuals to take control of their health while advocating for ethical, integrity-driven medical practices. Welcome, Michelle. It's so great to have you here today.
Yes, thank you. Thank you for having me on again. It's so nice to see you.
Oh, yes. And for our listeners, so I actually had Michelle on the radio show. Oh my goodness, I think it was well over a year ago, but I've actually been wanting to reach out to you because your whistleblower case is so unique. And this is something, at Functional Nurse Academy, I really wanted to support the whistleblower nurses because it's important that as nurses, we're mandated reporters. If just like if we see a patient getting abused, we need to say something. And also when there is systemic corruption that is leading to harm, we need to say something. And, I've actually seen some, articles come out in the media about your current case. Could you tell our listeners, what your current court case, what exactly is that about?
Yes, I'd be happy to. And just to hear that it came out in the media, that sounds like maybe it came out for the first time in the mainstream media. And so that is huge news, even if they worded it in a way that's not, the way we would like necessarily. Just the fact that it's being put out there, it's like finally we hit that block. So yeah, and I feel like since doing this case that we've had lots of blocks, and it just tells me that we're over the target. And this case in particular is to help expose the unethical business practices that have been happening in the hospital. And I'm very blessed to be in this position to be able to expose this truth, because for many, many years, the hospitals have been harming patients and through using vaccines, and they've been getting away with it. And so pretty much this case is exposing the vaccine harms that have been done. And that mainly includes the COVID vaccine. That was kind of like the silver lining of COVID vaccines, that this finally is coming to the surface. But it also includes hepatitis B vaccines, because I'm a postpartum nurse. So the beauty of that is the hepatitis B vaccine is like the first vaccine in the series of this, programming that they initiate these babies into. And so just by being able to get to the source, and expose the harms and the toxins and the dangers of that, really is just helping to set the stage for these babies as they grow up. Like if I'm able to give informed consent and help mothers decide whether or not they want to put these toxins in their babies, then they're starting off already on a better, taking a better step already as far as like taking care of their health. And so I kind of went on a tangent right now, but to talk more about the case, I've been a nurse for 8 years. I started off on the cardiac floor, and in 2020 I transferred to the postpartum floor. And all of 2020, I took care of these patients, these mothers and these babies, and I was so happy to be there because I loved these babies. I love taking care of this population versus cardiac patients, which I love taking care of cardiac patients too. But just to be able to see these new miracles come into onto Earthside, um, it was just such a blessing. And so I really believe that God put me on that floor. And these mothers were basically healthy in 2020. They would come in, deliver their baby, and go home. And then in the end of 2020, on orientation, I had to give a hepatitis B vaccine to a baby. And I didn't know anything about hepatitis B vaccines at the time. But when I gave that vaccine to that baby, I felt this gut feeling. I felt disgusted with myself. I knew that I never want to do that again. And so I kind of went down the rabbit hole on that vaccine. And instead of, or I actually told my mom that night, I said, I cannot give these vaccines. I need to go back to the cardiac floor. And she said, do not quit. Those babies need you and you're saving them. And so I went down the rabbit hole on that vaccine. I learned about what it's actually for, and why are we giving this to newborns, and realized that it's toxic and not necessary. And so I started giving informed consent to these mothers instead of giving the vaccine. And when I would tell the mothers that, hey, your baby's not at risk for hepatitis B, you don't have it. The only other way is through sexual transmission. Um, you know, so your baby doesn't need it. 99% of the mothers would say, okay, then I don't want it. So I turned that into giving informed consent, which is what nurses are supposed to do. There are nursing provisions that protect us when we give informed consent. So I kept going to work and I kept giving informed consent. And then in 2021, I heard that these COVID vaccines were going to start rolling out to the public and on pregnant women. And like springtime of 2021, we started having these mothers come in, and instead of delivering their babies and going home, they were delivering babies that had already passed away inside. And so it was devastating. All of 2021, I kept going to work and I would see these stillborns. And I was asking nurses around me, what is going on? Why are these babies dying? And other nurses would say things like, I don't know, pesticides. Or global warming, or mothers aren't that healthy these days. And it didn't make sense because in 2020, they were healthy enough to deliver babies and go home. And now every time I go to work, there's a dead baby. And so I started asking questions, and everybody around me was in this trance, and nobody wanted to, state the obvious that the only new thing that happened in around March of 2021 is this COVID vaccine that all these mothers were taking. And so I kept going to work, and then my mother was she went to the hospital in November 2021, and she was sick with COVID, I guess. I still have a hard time believing she actually died of COVID, but they unleashed the hospital protocols on her, and she ended up passing away in the hospital. And it was brutal the way that they treated her. And as a nurse, I could never imagine treating a patient the way my mother was treated. And so I told my brother when my mother was killed, I said, they messed with the wrong nurse, and I'm going to expose this hospital system for the evil that it is. And so I kept going to work, and I kept seeing these dead babies. And then in 2022, September, I received an email that stated the data it said in the month of August, there were 22 fetal demises. And that's a record number for the hospital. And that ties with the number of July in 2021. And so that's saying that there's 20 dead babies born every month for the last year. So when you went from 4 dead babies per year, stillborn babies, to 240 in 1 year, that's a huge safety signal. That should have alerted everybody in the hospital. Everyone who read that email should have been like, oh my God, this is a serious public health issue. This is like an emergency. We should figure out what the heck is going on. So that I couldn't believe what I was reading, because the nurse that wrote the email was very pro-vaccine. And so she obviously did not correlate it with the COVID vaccine, but the timing was perfect. It said from July 2021 to August or September of 2022. And so, um, at the end of the email, she said, we need, since there's been this increase in fetal demises, you guys need to brush up on your policies and learn how to handle a dead baby's body. And so the email should have said, not you need to brush up on your policies, because all I've been hearing the last 6 years or whatever is, oh, you need to follow policy. And to me, that just sounds like you need to follow orders. To me, it should be, we should get back to a place where we protect human life, where we advocate for patients, not, oh, just follow a policy. Because what policy, I don't even think policies are even that credible. They're written by someone who doesn't even seem to be at the bedside. And so anyway, it just sounds like follow orders. And so the email should have said, because of this increase in fetal demises, we need to figure out what's going on. It didn't say that. It said you need to brush up on your policies. And so I sent that email to a friend who's friends with RFK, and she sent it directly to RFK. When I did it, I believed that God put me on that floor. God sent that email through this nurse so that I could read it, because I had a connection to RFK. When all this was happening, I didn't even think that. I just thought, oh my gosh, this is a serious email. I'm sending it to Susanna. And it went straight to RFK. So he sent it to a few investigative reporters, and that email ended up going viral. And now, a lot of people in the public know about this. And thanks to that email. And thanks to me sharing it, I guess. So anyway, sometime I started going on all these podcasts, and sorry, is there a lot of feedback, or is it just me?
I can hear you just fine on my
Oh,
end. But if you
okay.
have the visuals a little blurry, so do you have anything else open on your computer? Like, could you close down any windows? That might help.
Maybe. Okay. Hopefully, I don't know. Is that better?
It's just once it processes, it might look better. So, but yeah,
Oh, okay.
oh, there you are. I can see you clear now. Okay. Okay. Go ahead.
Perfect. So I went on several podcasts sharing this email. And part of me thought, well, I could get fired for sharing this email. But I was also so upset about losing my mother that I was like, I don't even care if I get fired, because the public needs to know about this. And if I get fired, I'll figure it out. Something will work out. So I started going on all these podcasts, sharing this email, sharing this information. And then for a year or two in there, it got a little bit quiet. I think people were just a little burnt out about the COVID vaccine news, and so I took your functional medicine nurse program at that time when it was a little bit quieter. And I thought, okay, if I get fired, I'm gonna just be a functional medicine nurse. Plus, that's more what I want to do anyway, because I am all about getting to the source of issues and figuring out what your body needs, and helping to regenerative type nursing. So I took your program and I loved it. And thank you so much. And then one of your slides has like changed my entire life. It was the slide about the hepatitis B vaccine. And the one in particular, it said that the hepatitis B vaccine has 250 micrograms of aluminum. The FDA says do not give more than 18 micrograms of aluminum. And so I printed that page out and I started sharing it with nurses all around me, and started opening their eyes. And my boss saw that I was sharing it, and she called me into her office, and she's like, you can't share this form. This is called or considered solicitation. So you need to stop doing that. And I was like, okay, whatever. And because I had already shared it with all the nurses, so I'm like, okay, like everyone already saw it by now anyways, right? So and then in September of 2024, I went to New York, and I met with Mary Holland, the CEO of Children's Health Defense. And we had this health freedom rally over there, and I told her all about the hepatitis B vaccine, like how my workplace continues to give it even though it's not safe. And they keep telling me that I need to stop giving moms this information, that if they have questions, I need to tell them to talk to the doctor. And she said, if it gets really bad over there in California, just call me and I'll help you. This was in New York. And so I was yeah, so a couple months go by and it was like May of 2025, and a family member complained about me and said that I'm talking these mothers out of giving the hepatitis B vaccine. And that I told the mother that the only way your baby could get it is through sexual transmission, or and you don't have it yourself. And my boss called me into her office again and she said, "Yeah, we got a complaint about you and they told me this and this and this." And I said, "Yes, that's correct." And my boss seemed surprised, like she thought I was going to say, "Oh no, I didn't say that." And I was just like, "No, that's exactly what I said. I said it's not safe." And I said, "I'm not going to inject a baby with 250 micrograms of aluminum. It's not safe. I'm not going to harm a baby. It doesn't matter how much you're paying me. I'm not going to do it." And she told me that, um, she said, "I know you have your beliefs, Michelle, but you need to do what's required of you per the institution." And I said, "These are not my beliefs." And that it doesn't matter. I'm not going to cause harm to a baby. And so when I left that meeting, I was super frustrated because I'm like, I have facts right here, and these are not my beliefs at all. And when I state the facts, I don't get emotional about it. I just state facts. And they continue to say, "Oh, I know you have your beliefs," which I'm like, no, my beliefs are that, vaccines are, I don't even know. I don't know what my beliefs are. I just stick to the facts. I really. And so I called Mary Holland after that meeting and I said, "Look, it's getting crazy over here. Like, I need help." And so she sent Greg Glaser. He's an attorney in California with Children's Health Defense. And I shared my story with him. And then he contacted Children's Health Defense and proposed like a letter to ask if we start a lawsuit for unethical business practices and retaliation against a whistleblower, if they would cover the cost of this lawsuit. And they wrote back and said, yes, that they will, that they'll cover the cost of this lawsuit. And that's just such a blessing. When I read that they said yes, I dropped to my knees and I thanked God because I was just blown away. I'm like, this whole experience has been God guiding this. He wants the truth to come out. He wants somebody to stand up and protect these babies, his babies. And so I'm just blessed that I'm even able to do this. So that's where we're at right now. So we filed a complaint to expose the truth and basically prove that these COVID vaccines are dangerous, they're harmful, they're causing stillborns, and then also to expose the truth on all the vaccines, hepatitis B in particular. So that's one big part of it. The other part of it is they did retaliate against me when they found out that I was sharing that email because I went on Del Bigtree, and they questioned me for 40 minutes after that, and they were trying to get me to expose, or trying to get me to admit to violating HIPAA, and I didn't. And they asked me all these questions for 40 minutes and they said, "Are you aware that it's against company policy to copy and paste an internal document?" And I said, "Why are you wasting your resources investigating why I copy and pasted an email? You guys need to be investigating why babies are dying." And then they said, "You can go back to work." I thought they were going to fire me that day. And they said, "You can go back to work." And so when I went back to work, I was like, wow, that's interesting. That means that they know that there's something there, like that they're guilty because they didn't fire me. And then 2 weeks later, they kept a bonus from me. It was 2 days before Christmas. I had been promised a retention bonus along with I think 8,000 other employees that had remained employed during the COVID years. And it 2 days before Christmas, I noticed I didn't get my bonus check. And the nurses around me were like, "Oh yeah, we're gonna go shopping and get, my kids this gift for Christmas and pay off our bills or whatever." And then when I called HR, I said, "Hey, I noticed I didn't get my bonus. Did something happen?" And she said, "Oh, yeah, we decided to keep it from you because you broke the rules when you shared that email." And I said, "Wow, that sounds like retaliation." And she was like, "Oh, no, no, it's not retaliation. We decided that because," I don't even know what she said. It didn't even make sense. I'm like, "That's retaliation." And then I asked other nurses around me, like, "Hey, how much was the bonus anyway?" And they were, can you guess what it was? Or you might know already. Think about the most evil number that you know.
Was it $666?
It's close. It was $6,666.
Yeah.
Wow,
Mhm.
right?
Yeah,
That
that I mean, that doesn't shock me.
right? I know at this point anything anything goes. Yeah, so I didn't receive a check for 6666, but thousands of other nurses did, and they accepted it. And so when I found out it was that amount, I was like, "You know what? Never mind. You can keep your evil money, right?" But I'll remember that. And so the case, the start of this case, in order to even file the complaint, it we needed to have retaliation against a whistleblower. But the case, it's so much bigger than that. The retaliation part was just to help to start this case. But really, I don't even care about the bonus at all. The thing is, this case is going to just bring the truth out. So the more that I'm able to share what's going on and the more people are talking about it, the more they're going to really start looking into it. And so we're in 2026 now, and people need to know that the babies are still being born dead, stillborns. Like every time I go to work, there's still a dead baby. And prior to 2021, that was not the case. It was 4 per year. Now it's 4 per week. So it's
Yeah.
devastating.
Well, I wanna say one thing. Heaven forbid if I ever had to be in the hospital, I would want you to be my nurse, you know? And so a couple of things for our listeners. Okay, hepatitis B and aluminum adjuvants and COVID vaccine injuries, all of those things are things that I have vowed to never, ever, ever shut up about. I refuse to quit talking about it because it really is such an injustice and so many people have been harmed. And I want to touch real quick on hepatitis B and nursing. So in nursing school, we are taught we are the last line to that patient. So if the physician were to order a medication, that is too high of a dosage. When I used to work in pediatrics, the first thing I would do is I would look at the doctor's orders and I would confirm that that medication dosage was safe per body weight. I would not just, if I saw an error and the medication was too high, I wouldn't just go give it anyway because I'm following orders. That's a doctor's order. I could
Yeah.
refuse to give it and then go tell the physician respectfully, this is incorrect. Please revise it. When Michelle was referring to the aluminum adjuvant and the hepatitis B vaccine, that vaccine has around 250 micrograms of aluminum hydroxide, and a form of aluminum that has not been properly safety tested. And per FDA's own documentation, which I will so put that in the show notes, it says for parenteral nutrition, which is basically like intravenous nutrition that goes directly into the bloodstream. It says per parenteral nutrition, no more than 5 micrograms of aluminum per kilogram, which equates to about 18 micrograms per day of aluminum. And then that vaccine has 200, I'm getting mad talking about it. That vaccine has
Right.
250 micrograms of aluminum. And some other shenanigans I hear is people are like, oh, it's just, it's the same amount of aluminum that's in breast milk, and there is naturally occurring aluminum in the Earth's crust. So there's minuscule amounts of elemental aluminum that is bound to other compounds such as silica that it really inhibits the absorption and also like the oral consumption of crops that may have the minuscule elemental form of aluminum. How do we not understand as medical professionals that when we take aluminum hydroxide, we strip the aluminum of those protective compounds and then we inject it directly into the bloodstream at very high levels? Like, I do not understand how healthcare professionals are like, well, we're just going to go along with it. I
I
mean
know.
I mean, make it make sense. So I'm so proud of you for like taking that information and showing people. And,
Yeah.
I really do think that with the new administration, I like just about had a field day when I found out that they removed that universal hepatitis B
Right.
vaccination.
Yes.
And you're right. Like it is nonsense. If the mother does not have hepatitis B, how is that newborn going to get hepatitis B? Like, it's just, if you actually look up the risk, it's negligible if that infant is not in a high risk situation. And I also want to touch on the COVID vaccines. And this was something else that I'm like, just looking at Pfizer's pharmacokinetic study, which during the, COVID shenanigans, I had that on my desk whenever I would work with clients and they were getting the boosters. I would show them that data and I would say, are you aware that the lipid nanoparticle actually biodistributes all throughout the body, including things like the heart, the brain, the kidneys. And also, it wasn't properly safety tested in pregnant mothers. And I have heard this from multiple healthcare professionals that they were seeing issues like developmental issues and other
Yes.
problems in these babies that were born to mothers that were getting these vaccines. And I know so many other healthcare professionals that they're telling me that they're seeing these things. And I'm like, well, are you reporting it? And they tell me no. And so, and that like really like it hurts my heart that people see something wrong and then don't want to say anything about it. So, like when I hear about the things that you're doing, I am just cheering you on. And we're about ready to take a break. So, yeah, I want to get more into this after break because there's just, oh my goodness, there's so much to talk about. But I do want to remind our listeners, if you are a fed up nurse, I can absolutely help you at Functional Nurse Academy. I am offering the most comprehensive functional training on the market for nurses, and it also includes business mentorship. And all of our graduates are eligible for 90 nursing CEs, multiple board certification titles, and you can check that out at functionalnurseacademy.com. I do want to pause for a moment to remind our listeners. This show is also syndicated on America Out Loud Talk Radio, on the Nurses Report radio show and podcast. So you can also find me there on any major app. Hello and welcome back. This is Melissa Schreibfetter. And I am joined today by Michelle Spencer, who is a nurse whistleblower. She also is the founder of Healing Ground. And we did go over her whistleblower case, which thankfully was recognized by RFK Jr. and Children's Health Defense, who is helping her with her lawsuit to be able to hold hospitals accountable for unethical practices. And we went over how she was a whistleblower for the hepatitis B vaccines being given to newborns, and about how after the rollout of the COVID vaccines, she was seeing a significant increase in stillbirths. And I did want to ask you, Michelle. So, you said that your hospital went from about 4 fetal demises per month to about 22, and and are you still employed at that hospital?
It was 4 per year. 4 stillborns
Four
per
per
year.
year. Okay.
Yes, to 4 per week. Um,
Goodness.
yes. The other day there were 3 in one day.
Oh, and
Yeah.
and what area of the country are you in? You're in California, right?
California, Central
Okay.
California.
So,
And this is all
in
public now because it's a case, and so it's in Fresno, California. Um,
is this
and
happening? Oh, go ahead.
I am still employed because I'm a whistleblower. They haven't fired me yet. Um, I believe they're going to in a month or two, actually. Which it's okay because I'm a functional medicine nurse, thanks to your program, and I'm gonna be okay, and I know that God is guiding me, protecting me. But they actually wrote me up on December 5th, 1 hour after HHS said to remove the hepatitis B recommendation from or mandate from the newborn schedule. That happened at 9 a.m. Pacific time. And then at 10 a.m., they called me into the office, my HR and boss, and they said, "We're writing you up because you're refusing to provide standard of care." And I said, "No, I'm not refusing to provide standard of care. I'm refusing to harm a baby." And then they, went over the write up and they said, "Do you have any questions?" And I said, "Yes. Did you hear the news today?" I was so excited to tell him that it was like literally removed an hour ago. And he said, "I don't care about the CDC. I don't care about the FDA. I don't care about the news. All I care about is that you're following the standard of care." Is that not crazy? That's crazy.
And also and it really is, and they actually they did revise the 2025 Nursing Code of Ethics to say that if something is going on unethical within the facility, the nurses, we need to do the right thing for the patient. Okay. So like
That's
if there's a
great. Yeah,
policy that is unethical, we don't just go with it if it's something that could potentially harm a patient that we have. So, but
exactly.
I am curious because it seems like, I feel like we've seen this mass exodus of nurses that are done and they're getting out of the system because they're like, I can't work in that environment. And I will say, I do have other nurses that I've trained that are functional medicine nurses with their own business, but they're still part time in the system because they love their patients and they want to be one of those nurses, one of those ethical nurses that's still scattered in the system because I think that like we really can make a difference having those voices within the system. But you mentioned something that was interesting about the fetal demise, that people were like, oh, maybe it's pesticides or it's global warming. Is this, are people saying that like, oh, it's just that one hospital that you work in? Or are people recognizing that this is actually like happening nationwide? Because I understand that Mississippi actually declared a state of emergency due to the increase of fetal mortality. And to my knowledge, this has been a consistent trend around the country. So are you hearing the same thing? Or do you know of any other, you know, um, any other nurses that are in this specialty that are saying the same thing that maybe in other regions of the country?
Yes, so that is a great question. Dr. Thorpe is in Florida, the OBGYN. He's been an OBG for 40 years, and he knows sonographers all over the United States and in Canada. So the higher vaxxed states have higher rates of miscarriages. And so it is a countrywide thing. My boss one day, after my investigation, came over to the nurses station and said, "Yeah, people just aren't having babies." She said that the birth rate is really low and we don't know why. It's not an insurance thing. We've checked. And so my boss knows what it is because she was in the investigation with me. She knows that I said it's the COVID vaccine, but everybody's still in denial. The ones who are still pro-vax or pro-COVID or vaccine, and they're in denial. They can't hear me when I say this COVID vaccine is causing these stillborns. It's like they just are in complete denial. So in the hospital itself, a lot of nurses are still pro-vaccine and they still haven't connected the dots, but nationwide, it is happening. So to know that Mississippi claimed a public health emergency over this, that is devastating, but also it's good to know for my case also. Like, look, there's another state that this is happening so that at least hopefully all the states can kind of start joining. Um
And, and also wanted to ask, so, because I am so interested in what is going on in the hospitals because I've been out for some time, and it's like the twilight zone,
yes.
how indoctrinated some of these individuals are. So, when the hepatitis B vaccine was removed from that universal as a universal recommendation, which we do know that again there are people in healthcare so radicalized about the vaccine schedule that there are healthcare professionals that have called CPS on parents if they refuse to give the hepatitis B vaccine. Did you, when that was removed as a universal recommendation, Was there like an outcry within the hospital? Were people upset about it, or were they confused? Were they supportive? I'm just curious what the reaction was.
So I don't think a lot of the nurses even know that that happened that day, and they're still giving the hepatitis B vaccine. So because of our governor, I hear that they don't even care about the new
Oh, California.
recommendations, that
Hmm.
he's just gonna separate California and continue to be the way that we are. Um, so it's really frustrating because I tried to tell my boss in the meeting that it was removed and they didn't want to hear it. And every time I talk, they don't want to hear it. So the head pediatrician is so pro vaccine. She's much older and we work on a women's health floor with women who are family oriented, obviously. And this doctor wears a badge reel that has like transgender flags and rainbow flags. And I'm like, how are you going to work on a women's floor that's like all about families and you're wearing these stickers? But whatever. I'm trying to not be judgmental right now, but she's the head pediatrician. So when I had a meeting with my boss, she was like, if you have questions about the hepatitis B vaccine, you need to go to the head pediatrician. So passing the buck, right? And I was like, okay, fine, I'll do that, even though my boss should technically do that. And when I went up to her and I showed her the Hep B vaccine information that slide, she was like, "Oh, that's not the same aluminum. It's not a neurotoxin." And I was like, what? Like, how are you gonna say that?" And so she's so pro-vaccine. That's the head pediatrician. So whatever she decides, it's like the rest of the hospital follows. And so there wasn't really an outcry because not enough people even knew about it that day.
And what I'm seeing too is for so many people that don't have a relationship with God. If you don't have a relationship with God, you are likely to make something else your God. And I have seen this quite a bit in healthcare, where healthcare and following the science becomes a false idol for a lot of individuals. And you see people with an immense amount of education making that believe these ridiculous things. I mean, how in the world is aluminum hydroxide not a neurotoxin?
I know.
I just can't with this. And I'm also curious. So you mentioned that they've written you up. They also withheld your bonus. Have you experienced any other retaliation? Like, have you experienced any bullying or anything else because of you blowing the whistle?
Yes, not from the nurses directly, but there was another meeting that we had with like 30 nurses, and we went through 2 hours of nursing information slides that were, typical slides about like changes and stuff, like typical stuff. And then at the end of the meeting, my boss said, "Okay, you're all, welcome to your feelings. This is a safe place, and your thoughts are or your feelings are important." And then she said, "But the hepatitis B vaccine," she's like, "there's been a lot of controversy lately, so if patients have questions, you as nurses," she's talking to all of us in a room, um, if the patient has questions, you need to tell them, let me refer you to the doctor. And then a couple nurses around me, they started speaking up, and I was blown away because I never imagined that they would finally start pushing back, and they did this day. And it was a beautiful thing. One of them was like, "Yeah, but the parents don't even want it half the time." And then the doctor will go in there and tell them if your baby doesn't get it, they're going to die. And that's fear mongering. One of the nurses said that. And she was like, "Well, then, they just need to have a conversation and continue to ask questions or something. But if the parent doesn't want it, that's okay." And then another nurse was like, "Well, it's not. it's not even necessary if we check the mom first and she's negative. And then my boss was like having a conversation with them and they're speaking up in front of all these nurses. And I was blown away. I was like, oh my God, like finally they're listening to me because I have like pounded it into their brain for the last couple of years with that slide. And just every time the hepatitis B vaccine is ordered, I'm like, you don't need to give that. It's not safe. It has this and this and this. And then the nurses are like, oh, you're right. Like I pretty much have convinced, I don't know, given them informed consent, really, and to where they're like not comfortable giving it. And then finally, so my boss is conversing with them, and I finally said, a lot of your nurses are uncomfortable giving that shot. And do you just not care about how your nurses feel? And then she was like, this isn't the platform for that, Michelle. And just cut me off. And so, yes, anytime I talk, they're like, they want me to just shut it out. Like, no, no more. But I left that meeting again, super frustrated, but also like, oh my God, the nurses spoke up like that. I think that was like the first time they've ever done that. And
That's so wonderful because
yeah,
there's so much groupthink in the hospital, and again, I think that there were so many nurses that were all gun ho about the COVID vaccine, and so many people got sick from it, and then saw that they still got COVID. So that was a huge
yes,
thing to it really opened the doors for that vaccine skepticism to become more mainstream. But I know when I was in the system, it's like if you said anything negative about the flu shot, which is like a religion every year, there would
right.
be people that would not like you and would bully you. And so I'm really glad that, especially even in California, that environment is changing. So, but yeah, I'm so happy for like the work that you're doing. And then also when you're courageous and you do the right thing and you use truth as your tool, because again, um, you're just telling people the truth. And, you can verify that on the FDA's website and on the package insert
Yep.
of the vaccine. So you're just telling people the information that is available, which is what we should be doing. And so I also wanted to pivot a little bit because I do want to talk about what you are doing on the functional medicine side. And I want to talk about the healing ground. So, how is your practice going?
It's going great, and I do NAET therapy or NAET, which is like acupressure, and it's to help reverse imbalances, energetic imbalances in the body, using different pressure points, and it helps relieve allergies. It helps with like emotional things too. So it's a beautiful thing. So I kind of incorporate functional medicine with my NAET treatments. And so I can muscle test and find out like what the body needs or based on symptoms, but I just now instead of just doing NAET treatments, I add functional medicine. And so I never have to advertise. You know, my best way of getting patients is word of mouth, and I treat patients every day when I'm not working at the hospital. So, I just love it because as I was going through your program, I was like, I already do this stuff. It's like when I'm muscle testing and I'm helping to treat people. And so this just adds to it and it's great. I love it. So, I do most of my work in person when I'm doing NAET, but then like I can also do some of this healing work remotely. And so that's where I'm at with that. Being at the hospital part-time still, I I don't do as many treatments as I could, obviously. But that's my plan. Like when I get fired, I plan to just go full time doing functional medicine nursing and NAET treatments.
And again, like I love that you're building your business. And that, and for our nurses and other healthcare professionals listening, word of mouth is king. I mean, if you have these satisfied clients and you just think about how awful our healthcare system has gotten and how people with chronic conditions are being underserved. So if you actually help these people, first of all, they're going to come back to see you. I mean, I've had clients that I work with and I helped them significantly. And they may come back and see me on like a yearly basis, basically, just to do labs and just to kind of like as like a tune-up. And then, but then, your goal is when you're in your private practice is to get people so healthy that they're not dependent on seeing you all the time. But
Right.
they will go and they'll tell all their friends and their families about you because
Exactly.
it is functional medicine, I think, is the future of healthcare. It's where we need to go. But there's a lot of people that are not practicing with integrity. And again, nurses, like we have seen firsthand so much of the suffering that goes on when people are chronically ill. And then once we have the tools and the skill set to actually help them to get the body back into homeostasis, I mean, it is just the best thing ever when you
Amazing.
actually you're working with someone and the next time you see them they're better. And do you
Yes.
have a success story that you'd like to
Oh, I
share from someone
do.
that you
I
worked
do.
with? Okay, wonderful.
And that's where I light up, when I see
Mhm.
these results where patients like feel better and they look better and you just know they actually are better because I do have an amazing success story and I primarily work with right now a lot of autistic kids and I call them autistic, but I think many of them are actually vaccine injured. So I have a 2-year-old patient that his mom brings him to me. He's had about 15 NAET treatments and so and I incorporate functional medicine recommendations, of course, and when I do treatments with him. But, I do the standard NAET treatment on him. But when he first came to me, he was 2 years old, extremely anxious, kind of crawling all over his mom, and then would like run around the room with no direction, was completely nonverbal, had never said mom or any words at all, could not take any direction at all. Like 2-year-olds normally by 2 years old they can listen and interact with you. He couldn't make eye contact, completely not diagnosed autism, but would have been down the line. And so the first time I treated him, he went home. He was super anxious that day, and the second time he came in, he was not anxious. And when I treated him through his mom, he was calm. And then during like a 20-minute hold when, before they left, I was like, okay, I'm going to go because I have to go run an errand and, I'm going to leave a little bit early. And he came over and grabbed my hand and made me sit down. And his mom was like, he's never done that. And so even just that connection that he was like, he knew I was leaving. He came to make me sit, like, don't leave. And I was like blown away. And then the third time I treated him, after that treatment, he said the word apple at the store when his mom was putting apples in a bag. That was the first time he'd ever said any words, period. And he said apple. And then he said blue the next day. And then I treated him again and he said mama. And she recorded it. And then he fed himself rice. And that was the first time he'd ever fed himself. So in the last 4 months, he's doing all these things that he has never done before. And so I have a lot of hope for him because he is vaccine injured because the pediatrician that she was bringing him to is so pro-vax. And so I know that he was completely vaccine up to date up until he started seeing me. And then he got sick recently. So his mom took him to the doctor and they prescribed Tamiflu for him. And when she brought him to me, she was like, yeah, they prescribed Tamiflu, but I don't know if I want to give it to him. He's making all this progress and I don't want to set him back. I was like, no, don't give him Tamiflu because even for adults, Tamiflu is toxic. And I was like, no, he's doing fine. And he recovered so fast just from hydration and some rest and a treatment. But yeah, he's doing amazing. For only 4 months, he's seen me about 15 times. And he's just doing this amazing stuff.
Oh, that is so wonderful. And again, when I was pregnant, I got the flu and they offered me Tamiflu. And
Oh
I
no.
almost wanted to just be like, have you lost your mind? Because again,
Right.
it's not effective, guys. I mean, I think that it may only potentially decrease your symptoms by like maybe 17 hours. And there have been very severe adverse outcomes. There have been people
Yeah.
that have had near death outcomes from taking Tamiflu.
Yes.
I am shocked. I am shocked it's still on the market. But like, I'm like, okay, first of all, still on the market is a problem. But then you're recommending it to like
A baby.
babies and to pregnant women. Like what?
I know.
Oh my goodness. So it's so nice to have someone here that I can talk to with common sense because I mean, the common sense is lacking in healthcare. It's scary, but I'm
Yeah.
glad that you're doing this work. And also, I would love, while I have you on here, I would love to hear how Functional Nurse Academy helped you with your business.
Right. So it's beautiful because functional nursing helps you get to the source. And you're not treating the symptoms. You're finding the source and you're helping to support the body so that you can recover from autoimmune issues. And so it's changed my life, really. And even though I feel like I still need to get more into it, like put more time into really functional medicine, and I just haven't yet because I just graduated in October, and then I also am part-time at the hospital. But yeah, so but knowing that there's ways to get to the source and help treat that and help you recover and help you get your life back, that's just life changing. And so I definitely have used it with my patients, and I hear all the time people say that I wish I had come to you sooner. And the thing is, they find me when they're sick and tired of being sick and tired. And if they had found me sooner, definitely would have helped them sooner. But they're finding that the conventional model of medicine is not helping them. And so when they finally get to functional medicine, it's a blessing to be able to help them recover. It's like they get hope again. So it's been life changing. And then of course the hepatitis B vaccine slide that you have in your program, like I felt like so lucky to take your program and find that whole chapter on vaccine injuries, because that's not talked about enough. Because we talked a little bit about the vaccine cult that people are in, and we need to help people like get out of that cult. Like, just let's talk about it. Like, we're talking about the truth here. Like, you don't need to keep protecting this cult that you've been enslaved in. Like, it's in a different time now. We're in 2026. Like, let's just be true with ourselves, with each other, and let's just be connected with each other and help people get better. And we don't need to be dependent on like medicine. We need to just be independent. And so yeah, your program changed my practice. It enhanced it. It goes all together with everything that I've been doing and fighting for over here. So thank you for that.
Oh, you're so welcome. And I love that you are you're helping people with all kinds of symptoms and conditions, but I really like that you are focusing on vaccine injuries because this is such a vulnerable population. They experience so much gaslighting and even in holistic educational programs. I mean, there are so many programs that were supposed to be the alternative, but then
Mm-hmm.
there's so many programs that refuse to talk about it because it's controversial. But I'm like, if we keep refusing to talk about it, we refuse to provide any training to healthcare professionals, then again, we have this suffering, vulnerable population that's going to just continue to fall through the cracks. So I'm really happy to hear that you are actively working to fill in that deficit to really help that population of people. And also,
Mm-hmm.
when we talk about your training and going through the program, was there a specific, I know you mentioned that you really appreciated the education on vaccines. Were there any other components of the training that you found especially helpful?
That I just really enjoyed listening to your slides, and you provided a lot of information, and it's relevant. And I would often like go on walks in the park and just play your slides. And the aspect where we can order labs is really helpful too, um, because a lot of it just helps people get a baseline for where they're at. So that's just a nice addition to my practice. And I like the information on nutrition that you provide, the umbilical cord part about how there's like over 200 different toxins or chemicals in an umbilical cord blood. That was pretty eye-opening. So the way that you inspire people to live healthier lives and to get rid of toxins in your environment, all that, that was all very helpful. The whole program was awesome. I
Oh,
appreciate it.
great. Well,
Yeah,
yeah, and again, there's so much information out there, you know. I mean,
right.
but again, there's so much we can do to help people, you know. And
Mhm.
well, we have a few minutes left, and I know that we are going to have listeners that are going to want to work with you. So, if someone wants to work with you, what would their next steps be? Like, how do they? Are you able to see clients multi-state, or are you just seeing people in California? How does that work?
I can see anybody anywhere, and because I'm in California, it's not restricted, I don't believe, but you can reach out to me on Facebook at Healing Ground. That's
Hmm.
probably the most active place. I need to work on a website, so that's not active yet. And then my email, if people want to, is healingground@yahoo.com, since a lot of people don't use Facebook necessarily. And I welcome people to reach out to me. And I know with your program, a lot of nurses probably do contracting where they have like a contracted, like 4 months kind of program that you were talking about, where you pay up front and then you see patients so many times. I kind of like to do a la carte work. So I think for some people that is it might work better for them in some ways, where I can like do a remote treatment and do like functional medicine recommendation type work. So I just wanted to put that out there. And then I feel like I just am trying to kind of like manage both, like doing hospital work part-time and then doing functional medicine work part-time. So I think if I'm not at the hospital anymore, I might change my practice and do more like contract work, but just at the moment I am doing this way. So it seems to work for me that way too.
Okay, yeah, and I know that you mentioned before that you love working with the babies.
I
So
do.
that is, I know that's like purposeful work for you. So I am wondering, I know that you mentioned that you feel like because of the whistleblower activities that I know that you said that you feel like they're going to end up letting you go. If that's not the case, do you plan to continue working just to have like your foot in the system to work with that population? Or is it your goal to be completely out of the system?
Long term, I plan to be out of the system, but right now I feel like I'm still doing a lot of good there. And
Mhm.
I do love the babies, and
Yeah. Uh-huh.
so that's why I'm still there. And I'm providing a lot of informed consent, and I'm starting at the source with the newborns, and so that's why I'm proud to be there. So
Yeah. Yeah. Well, and again, like just having you in that system, I think that I think that you're doing a lot of good because I think that you're waking up a lot of other nurses. And then
mhm.
when you have like one nurse or just in general, when you have one person speaking up, telling the truth is contagious. You
It is.
know, and I think
Right.
that also having the courage because, the hospital system, it is not this like positive work environment. It really isn't. And there's a lot of bullying and retaliation when someone goes against something. So,
Yep.
well, I am so glad that you were able to come on the show today. And for our listeners, I will be sure to put in Michelle's link to her Practice a Healing Ground, which is a Facebook business page. I also am going to link her email if anyone wants to get in contact and work with her. So, to
Thank
all of
you.
yes, you're so welcome. That is all the time that we have today. Thank you so much for tuning in. And again, if you want to learn more about the Functional Nurse Academy, please feel free to register for our next live webinar, and you will see that link in the show notes. You can also check out Functional Nurse Academy on our social media platforms or on our website at functionalnurseacademy.com. Until next time, Be safe, be well, and God bless.